Right. All right. Good morning, everyone, and welcome to the San Anselmo Library's virtual program today, 10 Warning Signs of Alzheimer's with the Alzheimer's Association. I'm Sariana, the Adult Services Librarian at the San Anselmo Public Library. And before we begin, I'd like to thank the Friends of the Library and the Library Parcel Tax for sponsoring this program and all of our library programs. Everyone will remain muted throughout the presentation. If you have a question, please type it into the chat box. The presentation is broken down into modules, and Jean will be answering questions at the end of each module. Technology can be very fickle, and I want to thank you all in advance for your patience and understanding during this program. We are recording this program today, so I will try my best to send out the link to everybody later today or later this week. And please join me in welcoming Jean Giramonti, a volunteer with the Alzheimer's Association, to our virtual program today. Woo! Yay! Yay!
Thank you, Sariana. I'm pleased to be with everybody. I appreciate the opportunity to address everyone, so thank you for attending. I'm going to share my slide screen here, so hopefully everybody can see that up on your screen now. Again, my name is Jean Giramonti, and I am a volunteer community educator with the Alzheimer's Association. I've been doing this for about 3 years now. I am connected to the disease, the Alzheimer's disease, as a former full-time caregiver for my late husband, Art, who passed away in 2018. And that's how I originally got connected to the terrific Alzheimer's Association, to take advantage of all the resources and support that we do offer, including a very helpful support group for couples, the spouse in their group, those with the disease in their group, and their partners, spouses in our own support group. And that was invaluable. So that's just one of the many resources. And we'll talk a little bit about the resources available through the association at the end of the program. So I'm connected to the Northern California, Northern Nevada chapter of the association. We actually serve the greatest number of people in the country. We have chapters throughout the country, and we are one of the largest in terms of the people we serve. And Art and I lived in Marin County during those years of his disease. After he passed away, I moved up here to Santa Rosa. So I'm joining you from my home in Santa Rosa today. And so let's go ahead and get started here. This program is designed for those who want to learn more about the warning signs of Alzheimer's and other dementias, and those who have noticed memory, thinking, or changes in themselves or others around them. So before we begin, if you're comfortable and you want to share why you're here today, be happy to take a few comments. Curious to know if anyone is here because you're concerned about someone who might be showing signs of dementia, or that you'd like to learn more about this. So if you have a personal connection to the disease, we'd be happy to hear from you. If you have any comments, I'll give you a second to let us know that. And if not now, there'll be time later too. Okay, so throughout the presentation, we will see a number of videos that have taken place in various settings with experts and people living with the disease. If you have any trouble hearing or seeing, let Sariana know, send her a message, or somehow let us know that you need to get that fixed real quickly. Hopefully we won't have any of those technical problems. So let's take a look and see what it is we hope to teach you today. And by the end of today's program, this is what we're going to explore: the most common warning signs of Alzheimer's, to help you be informed about what is normal aging and what is not. So we'll compare the differences between normal aging and signs of Alzheimer's or other dementia. We'll talk about how to approach someone, have a conversation about your concerns with them or their own concerns about themselves. We'll talk about the the importance of early detection and why it's so important to get a diagnosis and the benefits therefrom. And then we'll talk about how a diagnosis is reached, the possible tests and assessments that take place. And finally, as I mentioned, we'll talk about the resources available through the Alzheimer's Association. So throughout today's, so any questions before I get started in the meat of the program here?
We have a few things already in the chat. Thank you everybody for sharing so far. So Jenny has asked, there's a couple of them are not questions, some are comments. So Michelle says, my mother was recently diagnosed with AD and possibly Parkinson's, mixed dementia. Jenny has said, I am concerned about my older sister who is having short-term memory issues, and when screened for an Alzheimer's research project, she couldn't be a part of it because her memory was not good enough. What should she do next?
I think there's going to be sections on that, so we'll defer that until we get to those sections. But if I couldn't answer it, then we'll ask it again.
Yeah, and then Lisa my mom suffered from dementia. She passed last year. Lisa, I'm so sorry for your loss. She's now curious with all the new advancements and how to detect and possibly stave off the disease. So.
Okay. There are a number of different programs like this. There's one called Healthy Living for the Brain and Body. In fact, yeah. I think we did that one for the Marin County Library at one point.
We had that one last month, actually.
You had that one. Okay, perfect. So that addresses some of those preventive measures that have been identified through some clinical research studies around the world, actually. So, but we don't really talk too much about the preventive measures in this particular program.
Yeah, and then Lisa also is curious about the OTC meds on the market for memory loss.
Okay, that's, I'll just make a brief statement about, like supplements and over-the-counter things that you see advertised on television. Some of them may be in fact helpful. We don't really promote them in the sense that they have not had the same rigorous peer-to-peer research where studies are conducted with duplications and blind studies, and they're not FDA approved as actual prescription medications are. So we always advise that you discuss that with your personal doctor before you begin taking a supplement or a OTC element. So.
And then one more question before we move on. I'm sorry to interrupt. Michelle asks, is it important to have an exact diagnosis?
Is the question, is it important to have an exact diagnosis?
Yes.
It is. I'm not sure how to handle the term exact because there's always some leeway, but we do have a section in this program, later in this program, that will talk a lot about that. So stay tuned for information on why a diagnosis is so important and how they're reached.
All right, sounds good. Thank you, Jean.
Sure. Okay, so throughout today's presentation, we will periodically check in with the Garcias. They're a fictitious family, and we'll follow along as Mary's daughters discuss their mother's memory changes and take action to find the cause. Now, please note that the Garcias' experience might be common, but it does not represent the exact experience for everyone, as situations vary from person to person. So let's meet the Garcias here. Mary, mom, she's a 73-year-old widow who lives alone. She's a retired teacher. She has always meticulously cared for her home, and her daughter over here, Lydia, has recently noticed laundry piling up and mail and newspapers scattered around the house. Lydia is the eldest of Mary's two daughters. She lives just a few miles away, and she visits her mother frequently. Now, Patricia is her other daughter. She lives in another state. She works long hours, and she's unable to visit her mother frequently. but she communicates with her mom and her sister frequently via phone and chat. So Lydia, again, is concerned about their mother's noticeable lack of tidiness and that she is continuously losing things. So she reaches out to Patricia, and we'll follow along here in their text communication. So she's worried, she keeps losing things. Her sister thinks, it's normal to get a little forgetful with age. And the key here is that Lydia says, well, but it's so unlike her. And should we worry? So they want to reach out to Dr. Salloway, who's a former neighbor. Now, I want to point out that although this is a fictitious scenario, Dr. Stephen Salloway is in fact a real MD, medical doctor, who has been recognized as a leading expert in aging, Alzheimer's disease, and other memory disorders. So let's hear what Dr. Salloway recommends or has to say to the daughters.
As we get older, cognitive problems become more noticeable for almost everybody, and it can vary from person to person. Typically with age, people have trouble coming up with the word they want right when they want it. They have trouble remembering names, and they don't think quite as quickly. What's more concerning, or what might be the beginning of a memory problem, is people have a lot of trouble coming up with words or names, and it's happening more frequently, and the words or names don't necessarily come to them later. And then they start misplacing things, but not just once in a while, because we all misplace things, but more often. And it begins to interfere day to day. That should be a warning sign for people that this might be the beginning of a memory problem.
So we're all here today to learn more about Alzheimer's and dementia and identify common warning signs of the disease. Now, you may have heard the terms dementia and Alzheimer's used interchangeably. While they are related, there are significant differences between the two. And we're going to hear more about this from some of our dementia experts now.
Dementia is the umbrella term for an individual's changes in memory, thinking, or reasoning. There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow and the blood vessels in the brain. Dementia with Lewy bodies, identified by specific brain changes throughout the brain that include the buildup of a protein known as alpha-synuclein. And frontal temporal dementia, which is marked by brain cell loss in the front sections of the brain or the frontal lobe. Each type of dementia may have distinct characteristics to cause specific behaviors in the individual, but there is also some overlap in behaviors among the types of dementia.
So Alzheimer's is the most common form of dementia, accounting for more than 80% of all cases. And next, we're going to hear what the disease is and what it looks like in the brain.
More than 100 years ago, Dr. Alice Alzheimer's described specific changes in the brain, what we call the formation of plaques and tangles. Now, Alzheimer's is a progressive brain disease that's marked by these key changes and is thought to impact memory, thinking, and behavior. The brain has three main parts: the cerebrum, the cerebellum, and the brainstem. Each one plays a role in how the body functions. The cerebrum fills up most of your skull. It is part of the brain most involved in remembering, problem solving, thinking, and even feelings. There are about 100 billion nerve cells, or neurons, throughout the brain that transmit messages in order for us to create memories, feelings, and thoughts. Alzheimer's disease causes nerve cells to die, which leads to the brain tissue loss, or what we call shrinkage, and causes loss of function and communication between cells. These changes can cause the symptoms of Alzheimer's disease, such as memory loss, problems with thinking, planning, behavioral issues, and even at the end stages, problems with swallowing.
And lastly, we'll hear from another expert about the importance of recognizing the warning signs of Alzheimer's.
It's important to know what the warning signs of Alzheimer's are and to be on the lookout. We know that we change over time, and the warning signs of Alzheimer's can be warning signs of a number of things, but when you see those in yourself or in someone you care about, it's important to check it out, to consult with a doctor, to find out what you're dealing with.
So as we heard, it's important to know what the warning signs are and to be on the lookout for these marked changes. The Alzheimer's Association, as a leader in this area, has developed a list of 10 warning signs to help people understand the difference between normal aging and common signs of possible dementia. Now, this list is intended to be a tool to help identify unusual changes in a person's memory, thinking, or behavior. It's important to note that this list does not constitute a diagnosis of Alzheimer's or dementia. These are simply the most common examples of changes experienced. Individuals may experience one or more of these signs in different degrees. So we're going to explore each sign and what some typical age-related changes might be. So let's start with memory loss that disrupts daily life. One of the most common signs of Alzheimer's, especially early on, is forgetting recently learned information. Others include forgetting important dates or events, repeatedly asking the same questions, and increasingly relying on memory aids or leaning on others for things or tasks once handled on their own. Now, a typical age-related change is sometimes forgetting information, but remembering later. Next is challenges in planning or solving problems. Now, some people may experience new difficulties in executive functioning, which includes developing or following a plan, or difficulty concentrating. Conversely, a more typical age-related change is making occasional errors when managing bills or household finances. Let's hear from John, who is living with dementia with Lewy bodies, about how he experienced this early warning sign.
I was probably spending 4 to 5 times more time preparing for something than I did, say, 5 or 10 years ago, because of I would lose my thought, I'd lose my focus, I'd get anxious, I wouldn't get to sleep. I was thinking of this, I was in my sleep, I was thinking about what I was anxious about, which was what I was trying to remember, which was what I was trying to prepare, which I was trying to do. So it was really a vicious circle of, so I was able to control it a lot, so that people wouldn't see things, and there weren't things to be seen. It's what was disturbing me was what effort I had to put into to do the things I used to do more easily.
In retrospect, one of the things I noticed about my late husband early on was that he began using one of these small little notepads, or lined notepads, and he was constantly making little notes, something he had never done before. But he informed me that he had to do that to remember things, and I didn't think anything of it. We all make little notes to remind ourselves, but it almost became an obsession that he was constantly writing things in this little tablet that he kept. So at the time, I didn't really make much of a big deal about it at all. It was only after other things began to occur that we finally took notice. But our next sign is difficulty completing familiar tasks. Now, people living with dementia often find it hard to complete daily tasks that used to be managed with ease, such as driving to a familiar place, writing a grocery list, or remembering how to play a favorite game. Now, conversely, a typical age-related change would be occasionally needing help say to use a microwave or a remote control device. This could also include having trouble with new technology that the person hasn't had the opportunity to engage with as frequently. So those are sort of typical age-related changes. Let's hear a little more about this from a dementia care expert.
Some people have difficulty with math or with reading in a way that's unusual to them. And once again, this is a change in that person. So for example, we all know somebody who was never able to balance their checkbook, right? So that wouldn't be a warning sign for them. But if somebody who always balanced their checkbook to the penny suddenly was paying bills, the same bill over and over, and not able to balance their finances, well, that would be a sign for them.
You know, another more critical sign that I noticed, again, this is before I had much information from programs such as this, or before I had ever contacted the Alzheimer's Association. So I was sort of operating blindly, but I was still working a rather demanding and full-time job. Art had already retired at this point, and so he took over most of the household tasks, such as paying the monthly bills. Well, I noticed we began getting late notices. So I would get, a phone call or an email from a creditor that, why haven't you paid your bill? So looking into it, I was observing Art going through the mail one day, and almost everything was ending up in the shredder. So I had to immediately intervene and find out, he was just unable to recognize the difference between valid and critical mail versus junk mail. We all get so much junk mail, it's kind of easy just to quickly get rid of it. So that was another pretty critical sign that ties in with that. Our next sign is confusion with time or place. An individual living with Alzheimer's or another dementia may lose track of dates, seasons, or the passage of time. They may have trouble understanding something if it's not currently happening, or become confused about where they are and how they got there. Now, this can become more dramatic or profound in the middle and late stages of the disease. Versus a more typical age-related change could be, getting confused about what day it is or when a scheduled appointment is, but figuring it out later. Next, number 5, trouble understanding visual images and spatial relationships. Some individuals with Alzheimer's or another dementia may experience vision problems, which can lead to difficulty with balance, trouble reading, and problems judging distance and determining color and contrast, which can all impact driving or navigating the environment around them. Vision changes such as cataracts, well, that's a more typical age-related change. Now, this sign shows us that these changes are not just about memory. It's important to think about all the other ways that someone's daily life may be impacted by any of these changes. Again, because it's a brain disease, we think of memory as the most obvious sign, but because it's a brain disease, there are other parts of the brain that get impacted with, behavior and visual changes and so forth. Our expert explains a little bit more. Let's take a look.
Alzheimer's disease is not just a disease of memory. It can affect other things too. It can affect the way that we perceive what we see. So sometimes somebody in the early stages of Alzheimer's might go to the eye doctor because they're having trouble seeing, and in fact their vision is just fine, but the way they're perceiving what they're seeing may be difficult.
Next is new problems with words in speaking or writing. Individuals may have trouble following or joining a conversation. They may stop in the middle of a conversation and forget what they were talking about and continuously repeat themselves. They might also struggle with finding the right word or call things by the wrong name. They may start using more descriptive terms to talk about something rather than the name of the actual item. A good example of this is They can't come up with the word wristwatch, so they might say something like a hand clock. So it's descriptive, you kind of know what they're talking about, but the word wristwatch doesn't get conjured up in their brain. So they use whatever works for them. I know Art adopted the term thingamajig, and that term became more and more frequently used when he couldn't come up with the proper name of something. Now, a normal age-related change would be occasionally having trouble finding the right word. I mean, we all experience that occasionally. The difference is that it hasn't become a constant trend or getting worse with time. Let's hear from Phil, who's living with Alzheimer's, about this warning sign.
The other thing that I've increasingly been struggling with are words, which I've dealt with words my entire life, you know, as an avid reader, as a reporter, as a writer. I struggle with them now.
Next is misplacing things and losing the ability to retrace steps. Now, this sign often causes concern in people. I want to clarify that this is not about just losing your keys on occasion. Misplacing things from time to time, but retracing steps to find them is a normal age-related change. A person with Alzheimer's disease may lose things and not be able to recall when it was last seen, or identify the location where it was placed, or he or she may put things in unusual places, such as putting shoes in the refrigerator. Because of the lack of executive function and awareness, the person may grow increasingly suspicious of others and start accusing others of stealing, and do so more often over time. Let's hear from Ruth Drew again to explain this sign further.
So some people wonder if, if they lose their keys or their glasses or their purse, is that a sign of Alzheimer's? And one thing that I would say about that is, for most of us, we might misplace something, but then if we retrace our steps, we can usually find it. We can usually remember. For a person with Alzheimer's, sometimes they're not able to retrace their steps. Sometimes that memory is just gone. And so when they do find their keys next to the phone because they got interrupted by a phone call when they were coming in and they set their keys down in an unusual space, so there they are next to the phone. If that happened to you or me, we'd probably remember, oh yeah, the phone was ringing when I came in the door. I put down my keys. The person with Alzheimer's might not remember. They might wonder who's moving their keys around because they never put their keys by the phone. So that's just a little bit of a difference in some of the dynamics with losing things in Alzheimer's.
And next is decreased or poor judgment. Individuals may experience changes in judgment or decision-making, such as using poor judgment when dealing with money or paying less attention to hygiene and grooming. And this can be especially common in individuals who live alone. Making a bad decision once in a while, such as forgetting to get an oil change in the car, well, that's a more typical age-related change. Let's hear from Teresa about this.
The way I kept my house, I wouldn't say I was OCD, but pretty close to it. And all of a sudden, everything was okay with me. It's like, oh, it's a pile, I'm tired. So my dining room table usually looked like it was someone's office, because I always would say I would do it tomorrow. And then my bedroom, as far as clothing, I would just put it in a corner, put it in a chair. And all of this is just, I wouldn't say it looked like I was a pet wreck, but really I was, because I never threw anything away. I always would say, I'll get to it, but I never did get to it. So just the way of my standard of living, it was actually decreasing.
Sign number 9, withdrawal from work or social activities. As we age, it's normal to feel uninterested by family or social engagements at times. However, someone who is experiencing dementia-related changes may start to lose their ability to hold or follow a conversation, and as a result, begin withdrawing from social encounters or hobbies. They may lose the confidence to engage in that way. This was something that I noticed, especially toward the end of the early stage of Art's disease. He became less and less comfortable accepting social invitations to join friends for dinner or going out. And fortunately, he was able to be open about what he was experiencing so that I kind of knew what was concerning him. But this had a big impact on our lives generally, because we were both, social people and enjoyed our friends and family gatherings. But I had to start sort of whittling down those occasions because it was becoming more and more, I hate to use the word, but Art felt embarrassed because he was unable to participate as he once could in group settings like that. Let's hear from Dr. Salloway a little more about this.
One of the most common changes, and early on, is the person's comfort zone shrinks a little bit, and then that gets worse throughout the course of the illness. So they're less comfortable going out, they're less motivated to do things than they were in the past. So there's some change in day-to-day functioning that way. I think people also lose confidence in their cognitive abilities because they may not recognize someone or know their name or find the right word, and they'll feel awkward, and they don't want people to notice that, so they feel more comfortable at home or in situations with family where they're very, very comfortable with that wouldn't concern them. So people tend to withdraw a little bit and be less outgoing. That's can be one of the early signs of Alzheimer's.
And our last sign to be aware of is changes in mood and personality. Individuals with Alzheimer's or another dementia may become confused or suspicious, depressed, fearful, or anxious. They might get easily upset, either at home or when out of their comfort zone. As we age, however, it's normal to develop very specific ways of doing things and become a little upset or irritable when our routine is disrupted. Someone with Alzheimer's or dementia may become fearful, angry, or easily frustrated, which is something that should be addressed. Again, Dr. Salloway will share a little more about this.
Another early sign of Alzheimer's or dementia is subtle changes in behavior. So all of a sudden, the family may notice the person is more easily irritated, or more impatient, or a little moody, or have a shorter fuse, or more anxious. Now, there's lots of things that can cause that, but often that can be an early symptom of Alzheimer's or go along with the early symptoms of memory loss.
So let's check in with the Garcias again. As we talked about earlier, Mary's daughters are concerned about the changes they're observing in their mom. And they want to know when it's time to see a doctor about the changes they've witnessed. So let's look at their conversation via text here. So they've looked at these warning signs that we just, and they think, well, mom's showing some of that, but how do we know if it's really serious enough to see a doctor? So thankfully, Dr. Salloway has some information here about that.
Memory is not all or none, especially when there are early symptoms or signs. So on a good day, people might function very well and not really no one notices there's a memory problem. But on other days, especially if they're tired, then things become more noticeable. So memory is variable. It's not all or none. And then there are different type of symptoms that develop for each person. So some people may have trouble with language, may have trouble with organizing themselves, may have trouble navigating while driving, and other people don't have the same symptoms. So you don't have to have every symptom of Alzheimer's to be concerned. And I think the most important thing is determining what has changed from that person's normal level of functioning. And usually people have a pretty keen sense of, what they can normally do well. And then when either they or the family notice that there has been some change from that usual pattern of functioning, that should be a warning sign to people, but they don't have to check up all the boxes.
So let's do a quick recap here, and then I'll pause for some questions. Dr. Salloway gave us a great recap. It's important to remember that these warning signs are intended to be a guide to help identify problems in memory, thinking, or behavior that may be related to Alzheimer's or another dementia. Individuals may experience one, all, or just some of these signs in varying degrees and in numerous or single occurrences. They do not have to experience them all for there to be a concern. And it's important to discuss any changes in memory, thinking, or behavior in either yourself or someone else with a doctor. So before we move on to our section about the importance of early detection, I will pause here, Sariana, if there are any questions that have come up.
So far, there's no questions in the chat. Let's get, does anyone have any questions? Mona has, Mona says, I know many people have no family or other social contacts. What about them?
Well, and at the end, we will talk a little bit about, how to contact the Alzheimer's Association. We do have a 24/7 helpline. It's not your typical call center. It's truly a source of help to answer questions. It is staffed with master's level clinicians and experts in this arena. And that's one good option. I know Marin County also has Office of Senior Services. I'm not sure that's the exact name of it, but there are such divisions in I think most counties. They can also offer some help. That's where support groups can be really invaluable too, to get help from others that are experiencing similar things. But I know that is a challenge.
There's a question in the Q&A. It seems that there are a lot of these signs are also symptoms, responses to the pandemic, anxiety, depression, reduced socialization, irritability.
Yes, in fact, the incidence of diagnosed cases of Alzheimer's, I just learned this a few days ago, that there's about a 17% increase in number of Alzheimer's cases during the 2-year period. First 2-year period of COVID. So we're not sure exactly what the correlation is, but the stress and the anxiety may have brought to light symptoms or signs that had previously not been recognized. And that's why when we talk about in these next few sections about early detection and diagnosis, why it's so important to seek medical advice to rule out other things that may be causing the signs or the symptoms, because it may not in fact be a form of dementia or Alzheimer's. It could be something else, could be medication related, could be a different condition.
We have another question in the chat. The neurologist doesn't seem very helpful. What other doctors can help? We need help navigating this disease and next steps.
If you'll allow me, I think we'll have a good answer for you in the diagnostic and assessments phase of this program coming up. Essentially, there are other specialists such as geriatricians who may be a better resource for diagnosis. And fortunately, in the Bay Area, we have, I know that Art and I ended up at UCSF in their neurology department, and they have a special staff addressing dementia-related conditions. But we'll get a little more specific about that in a couple of sections coming up.
Sounds great. If no one has any other questions, we'll continue on.
Okay, thank you, Sariana.
Thank you.
And we'll have time at the end too, I'm sure here. We're doing okay on time. So our next topic is early detection. it is key that we pay attention to what's going on with our cognitive health and not dismiss any changes either in ourselves or others around us as normal aging. Any change that's unusual for your level of functioning or that of someone around you is cause for concern. Many times, friends and family are the first to notice changes in someone's memory, behavior, or other abilities. In this module, we'll discuss why it's critical to address any observed changes early and seek answers from a medical professional. Sometimes the person is exhibiting symptoms. Sometimes the person who is exhibiting symptoms isn't aware or may not have the insight or the self-knowledge to know that they are experiencing changes, which is why having an outside perspective is critical. This is especially important. We talked a little bit about this, but this is especially important for individuals who live alone or are far from family and friends. Let's listen as Dr. Salloway discusses this, and then hear from a care partner who was the first to notice changes in her husband.
You know, it's a very interesting phenomena that people who have memory problems are often less aware of it than family members or their friends who know them well. One of the reasons for that is our ability to monitor ourselves, which is an important part of brain function, decreases when we start having memory problems. Not in everybody, but commonly, and more than half the people with memory problems. And so the person is just not keeping track of the trouble they're having day to day. But the family members are, paying attention. If they're paying attention, they see, boy, this is starting to happen a lot, and the person's not aware of it. So the family's more aware, and they may talk to their loved one about it, and they say, I've noticed you've been repeating yourself. And they say, I'm not repeating myself. And that could either be due to the fact that they're not aware of it, or they may not want to acknowledge it.
And what did Mary notice?
I was so adamant about what was happening to Daryl. I wasn't sure. I didn't know. And this wasn't the person that I know. This wasn't the person. Daryl was my husband was very, he always had to be building or designing or working with his hands. And it was getting to the point where he wasn't, and he was becoming very frustrated when he was forgetting to do things or go places.
So if you continue to observe these changes, it's critical that you plan to take the next step and have a conversation with the person or others close to them about what you've noticed. Now, this can be a difficult or uncomfortable conversation to have. And I get a lot of questions about this in terms of how do you approach the person with your concerns. So the Alzheimer's Association has developed a roadmap of 10 helpful steps to help make addressing memory concerns less daunting and more productive. Let's take a look. So we start by assessing the situation. First, what changes in memory, thinking, or behavior do you see? Just identify those, write them down. What is the person doing or not doing that's causing concern? Next, what else is going on? Various conditions can cause changes in memory, thinking, and behavior. Are there other health or lifestyle issues that could be contributing to these changes, such as stress, diabetes, or change in medication? Next, learn about the signs and the benefits of early diagnosis. You've already taken the very important first step by joining us for this program to learn about these topics. Do you notice any of these signs in the person you're concerned about? Next, has anyone else noticed the changes that you've observed? Check with family and friends. What, if any, changes have they noticed? And next, you want to prepare to actually have the conversation. Who should be the one to discuss concerns with the person? It could be you, a trusted family member or friend, or a combination. It's usually best to speak one-on-one so that the person doesn't feel threatened or ambushed, but use what you know about the person to judge what approach might work best. When and where should the conversation be held? It's important to have the conversation as soon as possible. In addition to identifying a date and time, you should also consider where the person will feel most comfortable. What will you or the person having the conversation say? You may want to build out somewhat of a script, or at least have some notes to go through this in a logical manner. Consider the following types of questions. I'll just use an example of my own here. Art was an avid reader, especially in retirement. He always had 2 or 3 books on his end table with bookmarks and moving in various speed and so forth. But he loved history books, so he always had those on hand. And so you might, I didn't do it this way, but that would be an example. You might say, I've noticed that you're not reading your books. He had pretty much stopped reading. And so you might say, you're not reading your books anymore. I'm concerned. Have you noticed this? Are you worried? In Art's case, he admitted that he kept forgetting the page before, so he finally gave up. You might also want to say to the person, how have you been feeling lately? You haven't seemed like yourself. Or, yeah, I noticed that you're using the cell phone trying to change the TV channel, and the remote control is being used like a telephone. So it worried me. Has anything else like that happened? So you want to just use what you've observed, do so in as open and gentle a way as possible, but expressing what you're noticing and whether the person has noticed that themselves. And importantly, offer to go with the person to the doctor. Ask the person to see a doctor and offer to accompany them. Try using encouraging words, such as, you might say, there are lots of things that could be causing this. Let's see if the doctor can help us figure out what's going on. Or you might say, the sooner we know what's causing these problems, the sooner we can address it. And I think it would give us both peace of mind if we talked to a doctor. Not everybody's willing to go get the diagnosis. They're fearful that that they might have what they're afraid of. If needed, have multiple conversations. Don't be discouraged if your first conversation is not as successful as you'd hoped. Write down notes about how it went so that you can prepare for any future conversations. And don't dismiss the changes you're noticing in that person simply because they're reluctant to address them or the conversation didn't go as planned. Come back at it in a reasonable period of time. And next, you can reach out for support. You can turn to the Alzheimer's Association. And again, you can call our free 24/7 helpline. We'll identify that number later, but you can call to talk with master's level clinicians who can provide reliable support and information, including about how to have this important conversation. And finally, see a doctor. Most people address concerns about memory, thinking, and behavior with their primary care physician first. And here's where we can talk a little bit about the question about a neurologist not really helping much. In some cases, the primary care physician may refer the person to a specialist for further evaluation. And examples of these specialists include, as I mentioned, geriatricians who have additional training in medical care for diseases and conditions common among older adults, generally over the age of 65. Neurologists who specialize in diseases of the brain and nervous system, Now, it's important to note that not all neurologists specialize in Alzheimer's or other dementias. In our case, I mentioned that we got to UCSF because our primary care doctor was familiar with their ability to manage these kinds of cases and diagnose these kinds of cases. But we had already seen a local neurologist in Marin who really wasn't all that helpful to us either. So finding the right specialist does make a huge difference. Neuropsych, and that's where the helpline can be of some benefit to you in terms of helping identify resources in your respective areas. Now, neuropsychologists can assess, diagnose, and treat psychological disorders associated with brain-based conditions. Psychiatrists who specialize in disorders that affect mood or the way the mind works. Art actually did see a psychiatrist after he was diagnosed with Alzheimer's, but he saw a psychiatrist who was very helpful. He didn't need a lot of intensive care. A little bit of medication for a period of time helped kind of control his anxiety and mood levels. So that was a very helpful referral that we relied on as well. And psychologists have special training in testing memory and other mental functions. And we'll talk a little bit about some of the tests in a little bit here. So that is, let me hit my screen here. So those are the 10 steps to approach your conversation with someone and get to the doctor. Now, our next section, hang on one second. So we now, I'll stop for questions in a minute here. I thought I was going to stop there, but there's a couple more slides. We now know what signs to look for and how to approach the conversation. So now let's discuss the benefits of early detection.
There are a number of benefits in early detection of Alzheimer's. For one thing, a person is able to have a voice in what happens next. They can make plans. They can live life more on their own terms. They can also make plans for the future, financial plans, care plans. They can let people know what they want, which can be a real gift later on. It also allows time for families to make plans and to make decisions about who can do what and figure out care and those kinds of issues. Some people are interested in clinical trials. Clinical trials allow people to have access to treatments that aren't available yet. And for some people, that can be a really important thing to pursue.
So just to recap here, paying attention to changes that you notice in people, especially regarding memory, thinking, or behavior, is important for early detection. If you do observe unusual behaviors or occurrences, take action by having a conversation about what you've observed. And consider using the 10 steps to approach memory concerns that we discussed as a guide for this conversation. And be sure to customize it so that you are approaching the person in the most supportive and comfortable way possible for them. There are a number of benefits to early detection, such as planning for the future, access to treatment options, and participation in clinical studies. It's like any major challenge in life. The more time you have to plan, to think it through, to take the steps necessary to handle that challenge as well as possible, that's why we recommend that, early detection and diagnosis. So before we embark on our seeking a diagnosis section, I will pause here for any questions that might have arisen.
Sorry, there I am. Okay, sorry, my mouse wasn't working. If anybody has any questions, feel free to type them into the chat or the QA. And before we move on, does anyone have any questions?
Okay.
I don't see any, but If anyone has questions, there'll be more time for questions later. Thank you.
Thanks, Ariana. Okay, so let's take a look at what may be involved in the medical process to determine the cause of symptoms. First, we're going to test your knowledge here with a true-false question. So if you want to answer this in the chat, you can put your true or false answer in there, and then Sariana will let me know what kind of answers we're getting. So this statement, is it true or false? There is currently no way to diagnose Alzheimer's disease.
I'm muted. Okay, sorry, I was muted. We've gotten a false so far. False, false. We have one true. We have another false.
Okay, well, most of you that answered false, or those of you who answered false, are correct. Contrary, the outdated belief that Alzheimer's diagnosis can only be made at autopsy, there are a number of assessments and tests that make it possible for healthcare professionals to diagnose Alzheimer's and other dementia with a high degree of certainty. However, determining the cause of dementia can sometimes be more difficult. So easier to say that a person has it, but not exactly sure yet how it's being caused back before that point in time. So here we're going to explore possible steps of the diagnostic process. Now keep in mind as we review these steps that not everyone may be asked to undergo each one by their doctor. And assessments include some pretty obvious things here. I don't think there's anything earth-shaking, but a careful medical history, a thorough physical exam, screening for depression, because oftentimes symptoms of depression can be quite similar to the symptoms that or the signs that we see in Alzheimer's and other dementias. Really important to interview close companions. And that's, if someone lives alone or is far from their close relatives and friends who, may not be helpful in this regard, but whenever possible, that's really important because the doctors are going to rely on information that maybe the patient can't answer, but their companion can. Again, nothing earth-shaking about the tests that might be conducted. Certainly lab tests, because again, we may want, we're ruling out things as well as ruling in things in an exam like this. The mental cognitive status test, our previous president sort of made jokes about, the 5 words that he could remember. Well, in fact, that is one of the pieces of this standardized psychological test. And Art received that test, and then they usually do a follow-up in about 6 months and maybe a second follow-up after a year to see whether or not the test results are declining or changing, because that's how they know whether there's progression. But these mental cognitive status tests are a series of 30-some questions, I believe. They're generally administered by psychologists who can interpret them and include rather basic questions. For example, a doctor might say, who is the current president? Or in what city are you right at this moment? Both of those questions are quite easy for most people to answer. Art failed at both of them on his very first test. They'll ask you to maybe draw a picture of a clock with, the time of day at 1:30, something like that. Again, something that people who don't have any kind of problems could easily handle. So it's things like that that they then look at down the road to see whether they're answering fewer and fewer of those questions correctly. Real importantly is brain imaging. Because Art had a pacemaker, he was unable to have an MRI. MRIs are often the test of choice, but he was able to have a CAT scan, and even a CAT scan was able to show the buildup of these amyloid plaques that are a sure sign of Alzheimer's disease. Not of all dementias, but definitely for Alzheimer's, these buildup of protein that have gone out of control. There's now things like PET scans that are even more accurate to diagnose Alzheimer's disease in particular. So those are the kinds of tests that should be, and the kind of exam that should be done for someone. And if you're experiencing what you think is giving short shrift to the exam, or the maybe the primary care doctor isn't all that experienced with handling these kind of cases, and that's a major effort that the Alzheimer's Association does engage in, trying to educate more and more primary care doctors and healthcare systems that this needs to become more of a common question asked, especially of people over a certain age, usually over the age of 60, 65, when they go in for routine exams, maybe begin to probe a little bit about any concerns that they or their companions might have. So let's get back to the Garcias here for a minute and see, they're preparing for answers about their mom's changes in behavior, and they wonder, do dementia-like symptoms always result in a diagnosis of Alzheimer's or another dementia? So let's see what their conversation is like. So they've been seeing the doctor, they're going well. And sister says, well, is it really dementia? Well, we won't know until we get a diagnosis, but let's ask Dr. Salloway, our good expert, Dr. Salloway, if it could be anything else.
Someone could have high blood pressure that's out of control, or they might have a thyroid condition that's not regulated, or diabetes that's not right, or on a medication that actually can cause memory loss. Drinking too much alcohol can make memory worse. So there are a lot of factors that go into cognitive difficulty with aging, that some of them can be remedied. And so we want to do everything we can to improve cognitive ability and quality of life.
So we'll do a quick recap on seeking a diagnosis. I want to mention one other specialist that isn't identified on that previous slide about the various types of doctors. And another good resource that might be relevant, and I learned about this in my support group many years ago, because Art had other health conditions for which he was taking medication. And as we added medications for Alzheimer's, I began to get concerned that, this cocktail of medications, what's going on there? And is that creating more issues or removing, so someone called I just lost the terminology, a pharmacologist is what, not a pharmacist, but a pharmacologist who, there aren't many of them around, but they can be very helpful in assessing that very issue of how many medications someone's taking and whether or not they need to be regulated, added, subtracted, or whatever. So that's another possible specialist that can be tapped into. So just to review what we've learned here, the diagnostic process will vary from person to person depending on an individual's specific situation and what the doctor feels is the right course of action for that person. And that's the reason why seeking advice from your primary care physician first is a good one, because generally speaking, they've had a relationship for a period of time, so they know the person a little bit better than just going to a first-time doctor. The diagnosis may be something other than Alzheimer's or another dementia, which is why it's important to investigate the cause of the symptoms. Unfortunately, stigma and misconceptions about Alzheimer's, such as, well, nothing can be done, that can deter some people from seeking a diagnosis. But getting information and support is also a critical next step. So let's learn a little more about what the Alzheimer's Association offers. Let's, if the diagnosis is Alzheimer's, what's next? Let's see what Mary's daughters, Lydia and Patricia, do. So they now know that mom has been diagnosed with early stage Alzheimer's, and uh-oh, what do we do now? It's for real. Where do we go from here? And so fortunately, the doctor has recommended the Alzheimer's Association as a good resource. This is one thing that I wished had happened after Art was diagnosed. Even at UCSF, we never got any. The one thing that the neurologist told me as we left the appointment, the initial appointment, was, or not the initial, but the second appointment when they confirmed the diagnosis. He looked at me with a very serious look on his face and he said, "Now be sure to keep Art engaged. It's real important to keep him as engaged with others and with activity as possible. Keep the brain stimulated." And that is good advice. I wish he had said one more thing, which is, contact the Alzheimer's Association or a resource that has the ability to provide answers and support for you. So that's where, we're going to head now, is what is the Alzheimer's Association able to do for us? And the association is in communities across the country, providing direct service to individuals and families facing this disease. So the Alzheimer's Association leads the way to end Alzheimer's and all other dementia by accelerating global research, driving risk reduction and early detection, and maximizing quality care and support. And our vision is a world without Alzheimer's and all other dementia. On this slide, you're going to see 3 of our key resources, but certainly not the only resources, but these are 3 of the key resources that many people have successfully tapped into. So the association is available wherever and whenever you need reliable information and support. The three of our key resources are on this slide. Our first one is the helpline, which I've mentioned. Here is the phone number, 800-272-3900. And again, it provides access to highly trained and knowledgeable staff who can help with education, decision-making support, crisis assistance, and resource identification. Master's level clinicians available around the clock, and help is available in many languages, more than 200 languages through interpretive services. So let's hear from Tim. He's a care partner who has called the helpline for support.
I've had a couple of phone calls that I've been able to make in to the call center when I've had a couple of quick questions that I wanted to ask. There's been a couple of nights, 2 o'clock in the morning, you have questions, you have anxieties, and I was struggling dealing with them, and it's amazing. It was one of the best things I ever did, was keeping the call center on my favorites now. Just to know that there's somebody you can call who is aware of what you're going through.
I completely identify with him because I used that helpline increasingly over time, even in the middle of the morning when I would wake up with a lot of anxiety. I was still working, as I mentioned earlier, and trying to handle the stress of my job and coming home and stepping into the job of caregiver, and going back and forth between those 2 roles without much time for myself. So calling that helpline was a way for me to ease my anxiety, to get some advice about how to proceed with things at work or with things with Art. And so I highly recommend this for any reason. You don't have to be in the throes of a crisis to call them. Just anything that maybe I haven't been able to answer in this program or that you're curious about, that's a terrific way to get connected with help. So next is our website, alz.org, alz.org, very robust website with many different sections to to look into and get information. It's often the first stop for individuals following a diagnosis of Alzheimer's or another dementia. It includes sections specifically for people living with the disease and for caregivers. So we're going to hear from Teresa again, who is living with Alzheimer's, about what questions she had and how the website helped her.
When I went to the Alzheimer's Association website, which is alz.org, there I was trying to find out more about what was Alzheimer's, what really is this disease, what is younger onset Alzheimer's, what is dementia, is there a cure, how long has this been around, how many people are affected by this, where can I go for resources, where can I go for help, what do I do with this? How can I handle this? Is there more people like me out there? Is there someone that I can talk to if I need to? And there I found the support line that's 24 hours a day. And there I found where I can go for workshops, where I can go and read things and postings that people have done, where I can find out what events is happening in the Alzheimer's Association, where I can see how it's affecting people around the globe.
And the last resource listed on this slide is our Alzheimer's Association and AARP Community Resource Finder. This is a wealth of community-based resources available in your specific area, or if you're helping someone on the other side of the country or in a different location, you can enter the zip code, or you can call the 800 number and get information for that particular area. But it includes information about long-term care and community-based services, local association offices and their offerings of programs and support services. So Tom, who is living with dementia with Lewy bodies, shares his experience seeking help from the association to find local resources.
Since I've been diagnosed with dementia, the one place that I know I can go to for assistance and help and support is to the Alzheimer's Association. There are people there that I know by name that I can contact if I'm having a difficult time or if I'm struggling to find some resource, that they will provide that to me.
So now that we've taken a basic look at Alzheimer's disease and what resources are available, let's talk about how you can take action if you're so inclined. Here's some ways that you can be of help, or if you want to be engaged. There are many volunteering opportunities, whether you can spare a few hours a week or make a more significant time commitment. Consider volunteering with the association. There are numerous opportunities, such as becoming a community educator or joining your local walk planning committee. And again, you can visit the website to learn more about that. Advocacy is a major pillar of what the Alzheimer's Association does. You can become an Alzheimer's Association advocate and speak out on behalf of the needs and rights of those facing Alzheimer's disease. We go to places like Sacramento and Washington, or our local legislators, and try to influence them to pass legislation that's going to be helpful in this arena. We need a lot of resources thrown at a disease that is only expected to increase over time in a rather significant way. So we're trying to pull all stops and get everybody engaged. We mentioned a little bit in this program Trial Match, which is the way that Alzheimer's Association and other agencies and organizations do research. Everyone can help advance Alzheimer's research by participating in clinical trials. And you can get started with the Alzheimer's Association Trial Match, which is a free, easy to use clinical studies matching service, so that you can find maybe something that you would be interested in participating in as a subject. The Walk to End Alzheimer's, you can form or join a team for the Alzheimer's Association. The Walk to End Alzheimer's and raise critical funds and awareness is held annually in more than 600 communities nationwide. Walk to End Alzheimer's is the world's largest fundraiser for Alzheimer's care, support, and research. This is generally held in our area for the North Bay is a combination of Marin and Sonoma counties. It's been held at the location of Sonoma State University in Rohnert Park the last couple of years, and will be again this year in October. So it's a wonderful outing. It's about a half-day commitment. If you're able to raise funds, great. If you're not and just want to join a team, that's good too. And then the longest day, I guess I'm wearing my longest day shirt. One of my strategies for reducing my stress when things got pretty dicey as a caregiver is that I started riding my bike again. After many, many years of not riding a bike since college, I decided that that was one pleasurable way for me to get out of the house, to get a little fresh air, to clear my head. And I found that stress was causing me to eat improperly. I was gaining a lot of weight during those years. And so bike riding was a good way for me to get started on changing that dynamic. And to this day, I really formed a passion for my bike riding. I now ride 140 miles a week over a period of 3 to 4 times a week. So that's the activity I use for the longest day, which can be done as an individual. And the longest day is centered around the summer solstice, June 21st, the symbolism being shining a light on this disease. And so people form any kind of activity. They can bake cookies on Zoom, or they can have wine tasting activities, or whatever suits their fancy. For me, the bike riding was a natural, and I've been successful in raising some donation funds for the association. So there are many ways that you can get involved with our wonderful group. So that concludes my presentation on the 10 signs, and I thank you for your attention, and I will stop sharing my screen at this point. Hopefully you've had a chance to copy that phone number down and open it up for final questions. So thank you.
Thank you so much, Jean. I found that very, very helpful for myself to know all of that information. Thank you. We do have a question in the Q&A right now. If Alzheimer's is one type of dementia, what are the other names of the other types? Or what are the names of the other types?
Yes. Parkinson's is considered a form of dementia. I wish I had my list in front of me. There is a number of different diagnoses that, we talked about frontotemporal dementia and Lewy body dementia. The differences are they have different impacts on the brain itself. If I can find I'll try and find my slide to list some of the others, if you give me a second. So if you want to move on to a different question, I can try and get to that.
Hello.
Sorry about that one.
So far, there's no other questions in the chat, but I have a few things I'd like to also say. The San Anselmo Library received a grant back in 2019 for a small collection of memory kits. While you're finding it, Jean, it's all good. And we do have those available for circulation. It's 7 memory kits geared towards caregivers and individuals experiencing dementia and Alzheimer's. Each kit includes activities and things to do just to help engage the brain, as Jean mentioned earlier in this presentation. And then we have one caregiver kit that has that has some books and a list of resources and a lot of information about the Alzheimer's Association. So I'm going to put the link to our website in the chat about the memory kits. If you are interested in any of those, you can also email me about those, or call the library. So this is our link to the memory kits. And then another thing is that on Wednesday, May 11th, we have the next program of in our Alzheimer's Association series, which is Understanding Alzheimer's and Dementia. If you are interested in joining that, it's Wednesday, May 11th at 10 a.m. I'm putting the registration link in the chat as well. And that was my little end of spiel.
Here's my slide of glossary of other forms of dementia. So down here on the list, I can open any of these up to give a brief description. I don't know that we have time to do them all, but for example, Parkinson's disease talks about, similar symptoms. Is everybody seeing my slide? Okay, we seeing it, Sariana?
I see it. So hopefully that means everybody else is too.
So, it's a lot of people think they have Alzheimer's and then they get diagnosed and they find out it's actually Parkinson's. So there is a lot of similarity. I know that, where's Lewy bodies? Yeah, Lewy bodies, dementia with Lewy bodies. I think a lot of us are familiar with the Robin Williams story. And, he was, after his death, we learned that he did in fact have diagnosed dementia with Lewy bodies, which may have explained some of his behavior and so forth. So if there's anybody who would like me to open one of these up, I'm happy to do that. We can look at a few more if you'd like to. Vascular dementia is fairly common as well. In fact, Art was diagnosed with both vascular and Alzheimer's, but the Alzheimer's was probably the predominant. The symptoms were predominantly from the Alzheimer's.
If anybody would like to see any of descriptions of the specific dementias, please type it into the chat. Sorry, Paula wrote, also Down syndrome is a big surprise for her.
Yeah, me too. When I first read that, let me click on it because I haven't read this in a while. I think the reason it's considered, all of these are considered dementia is because, as you look at what we call that umbrella term, there's so many different ways that the brain can be impacted or compromised. And that really, is why there are different names and different diagnoses, because it's a different part of the brain or a different degree of compromise in the brain. The vascular dementia really relates to cardiovascular health. And if you saw the Healthy Living for Brain and Body, you know that vascular health is easily tied to brain health, because with every beat of the heart, 25% of the blood pumped goes directly to the brain, which proves how important that circulatory system is to the brain health. And if any of that is compromised, like Art had high blood pressure, so he had a few of those TIA, traumatic ischemic attacks, TIAs, which are like mini strokes, they call them. So it was clear that he was having more going on than just the Alzheimer's. So
Judith has mentioned in the chat that the Buck Institute is conducting brain studies and everyone is welcome to participate, and they will follow you over time.
Great to hear, yes.
Just waiting for more questions. I think that might be the end of our questions, so I'm going to stop recording.
And I'll stop sharing.
Oh yes.